Finally, now that you're finished pre-rounding and rounding, it's time for post-rounds. What exactly are you expected to do after your team has rounded on its patients for the morning? I'm going to divide this into things that you have to do each day, things that you might or might not have to do, and finally, when are you done for the day? As soon as your team is done rounding and has a plan for all of its patients, the following are things that you have to do as soon as possible. First, putting in orders, which means writing for new tests, imaging, or medications to be given to the patient. For example, ordering a CT on a patient with recurrent pleural effusions. Calling in consults to other services. For example, calling nephrology about seeing a patient that might need dialysis. Writing your progress note for your patients. And following up on important lab or imaging results that were ordered from earlier in the day. For example, if you order a troponin level in the morning, you probably want to check what the result is when it's available later in the day. Depending on what these results are, your team could decide to change patient management dramatically, so be sure to check back in with your team on these. A few things on each of these. For putting in orders, you actually don't have the authority to put in orders, as you're not a doctor yet. However, you are able to write over the orders and have your supervisor confirm them. For EMRs, you would pen your orders, and any supervising doctor can confirm your orders to let them become official. However, this is highly variable. Some supervisors like you to practice putting in orders and are very good about confirming your orders, while some prefer to put in all of your orders themselves and don't want you anywhere near putting in orders. Calling in consults is pretty self-explanatory, but your supervisors might not ask you to call in every consult, as early on you might not be able to convey the important information to the consulting team due to inexperience. What's annoying though is that after the consulting team sees the patient, they often page your supervisor but not you about their recommendations. For your progress note, you need to write a progress note on all of your patients each day. The trend now is that your supervisor is required to write their own separate progress notes on the same patients, but there still might be some places that allow supervisors to sign off on your note to make it the official note. Find out what the expectations are at your institution. It's common etiquette to get the progress note in as soon as possible, especially if other services are involved, as they will look to the progress note to obtain recent information on the patient. As for following up on important tests and imaging, keep in mind which ones you have to follow up on, and check for the results throughout the day. If a new result dramatically changes a patient's management course, for example, if the CT shows lung cancer, you have to come up with a new assessment and plan for that patient, and confirm that with your team. However, what's sometimes frustrating is that if there's an important result, the radiologist or pathologist will often page your supervisor to let him or her know. So by the time you get in touch, a lot of the times your supervisor has already carried out a new plan without getting in touch with you first. It happens. Don't take it personally, as urgent things require urgent action. Alright, next let's talk about things that you might or might not need to do. I divided this into clinical stuff, medical education stuff, and free time stuff. In a day, you'll have X amount of time, and there will be things in each of these categories that are more important or less important. You basically have to triage your time between all of these, leaving time for the things that are important or absolutely needed, and leaving for later or another day things that are not important or not necessary. Let's talk about clinical stuff first. Go see all of your patients again in the afternoon. See if there are any changes or improvements from the morning. If you have a lot of time, talk to them, find out a little bit more about them personally, and take some time to answer any questions they might have. As a medical student, you have more free time than your supervisors, so get to know your patients better. At some point in the afternoon, your team will also likely run the list, meaning talk briefly about all of the team's patients. This is more to keep everyone updated on the progress of all the patients in the afternoon, but if needed, your supervisor might take you to see the patient again. Depending on how many patients you have, you might be asked to take new patient admits or admissions as they come in, so be ready to do so. Depending on the institution, you might also be required to attend sign-out in the late afternoon. in which the day team updates the on-call team about its patients before leaving for the day. In terms of medical education, there will be a ton of teaching conferences that you can attend. There will likely be medical student required teaching sessions that you will literally need to drop everything you're doing and go to, but there will also be lunchtime teaching conferences, morning conferences such as grand rounds, medical morbidity and mortality conferences, resident teaching conferences, and a host of other teaching opportunities that you might or might not be required to go to. Your supervisor might also sit down with you as well to go over some topics if there is time. If you do have some downtime, however, help research clinical questions that your team might have and present these the next morning, or read up on your patient's medical condition and treatment options. Lastly, we have free time. If there is literally nothing for you to do, then ask your supervisor if you can help with anything. The more time you can save your supervisor, the earlier he or she gets out and the happier they are, and the more likely it is that they'll try to teach you. For example, working on discharge summaries so that they are ready to go by the day of discharge really saves your supervisor a lot of time. Lastly, when can you go home? The safe answer is whenever your supervisor says so. If you finish all of your work and there's literally nothing to do, check in with your supervisor and they might have something for you to do or say that you should just go home. A lot of times this isn't entirely clear from the beginning, so don't be afraid to ask for clarifications. So that's it for post-rounding. We hope these videos will be helpful for you to make life easier for you when you first start on the wards. Now, here are our take-home points. You know the drill. Thanks.